Welcome to The Growing Dentist by Dr. Ali Raza Shah. Please like, share and subscribe our channel for more interesting videos. Today's topic is brushing your child's teeth. Did you know that teeth begin to form during the second trimester of pregnancy? Your baby is born with 20 primary teeth, many of which are already fully developed in their jaw. All toddlers are different. Some are more resisting to teeth brushing than others. Try to keep it simple in the beginning. Proper dental care should start as early as possible and well before your baby's first tooth appears. The necessary type and frequency of the dental care changes as your child grows. It's possible for the process to be easier and less painful. Brushing your child's teeth is often a struggle for many parents. Therefore, as being a dentist, I have shared teeth brushing tips for all different age groups that proves to work well. It is important to choose a proper sized toothbrush that will fit into your child's mouth. The brush itself should be with the soft bristles, hence, it will not damage the teeth. Character toothbrush, battery-operated vibrating toothbrush or a toothbrush that lights up and blinks are preferred for children, so that your child enjoys and learns early good brushing habits to prevent caries. Toothpaste should contain fluoride, barring any conflicting advice you may receive from a dentist. Fluoride-free toothpastes are recommended for children who do not realize the harm in swallowing it. We will now be discussing how to achieve a good oral hygiene in 3 different age groups of children, starting from birth till the childhood. Angle the brush bristles towards the gum and move gently in circles to clean both the inner and outer sides of the teeth and the gums. Switch strokes to brush back and forth on the chewing surface of the teeth. Throughout the brushing process, make sure your child spits out the toothpaste. Starting from birth, run a damp washcloth over your baby's gums to clear harmful bacteria from your baby's mouth. When teeth begin to show around 9 months, you can start to brush your child's teeth with an infant toothbrush. A small amount of toothpaste and water is all that is needed. Starting around 18 months, sit yourself down on a chair and have your child facing away from you on your lap. Tilt their head back, so you can see all of their teeth. Then place a small amount of a toothpaste on a soft toothbrush and brush their teeth. At around age of 6, your child is old enough to brush his or her own teeth. It is important to monitor the brushing, so as to make sure that it is being done properly for several minutes or not. Your child will likely not floss on their own, so it is important to help them in flossing. Babies and children can develop tooth decay if proper dental habits aren't started early. Putting a baby or a child to bed with a bottle can harm their teeth because the sugar in the juice or milk remain on the teeth or gums and can break through the enamel of a tooth. Pitted or discoloration of teeth can occur along with the cavities. Another sign of poor oral care is red and swollen gums or plaque, which are seen as a fluffy white film over the teeth. The goals of a children's dentist include preventing problems before they occur and maintain proper dental care. Many dentists, such as the team at The Growing Dentist, focus on creating an atmosphere that's fun and exciting, so your child looks forward to their next checkup. Proper dental care is important starting from birth and continuing throughout childhood. The type of cleaning routine and involvement needed by a parent changes over time. Seeing a children's dentist is important for preventing issues and maintaining optimal oral health. Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.